Thank you, Andreas, for this nice introduction. I truly have the honor to start this session where clearly a lot of interest by the people that are here. It's my honor to give an introduction and possible applications for nurses and allied health professionals when we are talking about natural language processing. I do not have disclosures except that I do not consider myself as an expert compared with the two other speakers in this session who are really the professionals. I'm a dedicated amateur, but anyway. This is something you are all familiar with, medical records, and by extension also your own notes or the notes of your colleagues, nursing notes, the notes of the physiotherapist, psychologist, and so on. If you have a close look at these records, then you will see that about 20 to 30% of the information that is included in these notes and in the records are in a structured way. This means that 70 to 80% is unstructured information, and unstructured information means plain text. Of course, it is much easier to do something with structured data, to interpret that, to analyze this, than unstructured information. And this phenomenon or this observation is clearly something where the metaphor of the tip of the iceberg pertains. A lot of the information that is there, but it is not reachable, not useful for us in clinical practice and in research. And the question is then, are there techniques, are there technologies that can help us to make this unstructured information insightful? And the answer is yes. The answer can be found in artificial intelligence. And artificial intelligence is a broad term to cover different techniques to teach computers to mimic human-like cognitive functions. And there are different branches within artificial intelligence. And it's not that they are mutually exclusive. There is some overlap between the different branches. And branches like robotics, machine learning, deep learning, you have heard about that before. But this is not what we are talking about when talking about the unstructured information. When we want to get insights on texts, we need to go or we need to look at natural language processing. And this is a technique that is used to process, like it says, and analyze large amounts of language data, texts. And it is not only able nowadays to analyze these texts, but also to generate these texts. And I come to that later on. It may be, for some people, sound a bit vague or abstract or high-tech, but you would be surprised how many people are using natural language processing on a day-to-day basis in their daily life. And the Google, Siri, Alexa, Home Assistants are examples for that. But it also is finding its way to our profession. For instance, a review that was published last year looked at the application of natural language processing on nursing notes. Is it possible to analyze the nursing notes and to try to get information out of that? And the answer is yes, it is possible. And phenomena that has been screened, that has been identified, variables that have been identified by these NLP are pertaining to mortality, hospital readmission, patient safety issues such as fall risk, infections from urinary catheters, wound identification and progression. It's clear that this is only the beginning. There is so much potential in this technology, and we only had these 5 phenomena that have been investigated so far as it was found in this review. Later on today, Yiyun and Megan will give other examples more in depth. One example that we are doing in my lab now, we are starting up a study where we want to identify indicators for the need for palliative care in cardiac patients. We know that there are screening methods, but it will never happen that all the cardiologists and all the cardiac nurses will screen all the patients that they see in the outpatient clinic or in the ward. So if there are other ways to get this information to the surface, it would be helpful. And we believe that there are cues in the medical and in the nursing records that we could make recognizable by natural language processing. Another nice example is the paper that was published this year, how such large language models could be used to identify social determinants of health in electronic health records. So it's no longer the case that we need to push for more screening. We need to try to find ways where the computers can do the work for us and bring this to the surface. Important is that you know that there are two ways to develop this kind of system. One is rule-based, the other is machine learning. And the rule-based, this is about programming. This is developing a code where you refer to the terms if this situation, then that situation. And you build an algorithm. For instance, if you would be interested in identifying shortness of breath in the clinical notes, then of course you need to look at the term shortness of breath, but also variants, short of breath, breathless, dyspnea, difficulty breathing, and so on. It is also important that you exclude certain things. If somewhere in the notes would be no shortness of breath or no significant shortness of breath, that you can exclude that. So that is a bit the programming that you have to do in rule-based NLP. Where a huge potential is in the machine learning. And that is when you hear people talking about the black box of artificial intelligence, it's about this that they are talking. You provide an input, you give the clinical notes, and you also give a kind of an output that you say, okay, this patient has shortness of breath, or this patient has a risk for or a need for palliative care. And then it's the computer that looks mathematically, do I find cues, and it is calculating how close or how far it can come to the outcome. How does it do this? We don't know. That is the black box. Machine learning NLP found its way to the greater public when ChatGPT was launched, so to speak. Again, ChatGPT, I don't think that there is anyone in the room that never has heard about ChatGPT. And we were, from the very beginning, also fascinated in what could ChatGPT or this kind of technology do for us. So we asked ChatGPT itself, like, is there a certain value for cardiovascular nurses and allied health professionals? And ChatGPT always gives an answer, also here, and it said, yes, of course, ChatGPT in clinical practice can be used to generate patient education materials, automatic charting and documentation, generating medication lists and instructions for patients, keeping up to date with the latest research and guidelines, and language translation to communicate with patients who speak a different language. Of course, this needs to be confirmed, this needs to be proven. And this is the first proof of concept that we did to see if ChatGPT is right about itself. When we are talking about patient education information, we know that generally it is written in a language that is too complex for patients. It is generally recommended that patient information should be written at the level of a 6th grader, which means someone who is 12 years of age. If you ask me to write like a 12-year-old boy, I cannot do so. I don't know how 12-year-old boys and girls, how they write. So we selected 3 patient information sections from scientific journals. We ran them through an health literacy check to see what is the reading level. Then we ran them through ChatGPT and Google Bard, now known as Google Gemini, and we asked, please can you reformulate the following text into 6th grade reading level? And that is the result. The starting point for patient information published in the JAMA was 11th grader. Cochrane, it was 17th grader. This is university level. This is clearly not meant for the general public. And the European Journal of Cardiovascular Nursing, 10th grader. And yes, Google Bard and ChatGPT was able to reduce the reading level or the complexity, but at the cost of a significant reduction in word count, which means that sometimes significant information was removed from the text. And for Google Bard, it was even up to 83%. And this brought us to the conclusion ChatGPT can successfully simplify written patient information materials and improve the readability, but it cannot achieve the desired 6th grade reading level. Google Bard, on the other hand, is capable of reaching this reading level, but it oversimplified the text by omitting up to 83% of the content. Another suggestion that ChatGPT gave about itself was you can use it to automate the charting and the documentation. And whereas this was a first suggestion, in the meantime, this is happening. For instance, a large healthcare organization in the United States has built in this technology in their medical record, and that means that handover notes are automated. For instance, in the Netherlands, there are some hospitals that have built in this technology in their medical record, and it is used to automatically write the handover notes from intensive care to the ward, and to write discharge letters when persons are discharged from the hospital to home care. How much time do you spend in writing this kind of notes? Imagine that the computer can do this, you do the checks, you correct where needed, it would be a huge time saver. Another suggestion was it can help you to keep up to date with the current guidelines. And first of all, it's important to know, don't use ChatGPT for that, because ChatGPT is not meant to keep you updated with the guidelines. But there are systems that are. For instance, this is a startup from Australia, and they trained such a language model with all the guidelines in cardiology. Imagine that you have a question. For instance, what are the current recommendations for preoperative assessment of frailty and functional capacity in patients undergoing non-cardiac surgery? How much time would it take for you to screen, to browse all the guidelines and to find the answer? Well, here you prompt it and you get the answer, and you also get the indication it's from this guideline at this page that this comes from. This also would be very helpful for nurses, allied professions to use in clinical practice. But there is something that we need to learn. You often hear critique on ChatGPT where people say, but yeah, the answer is not always what you expect. Well, the answer is as good as your question. And just asking one question to ChatGPT or a language model is not necessarily the best way to do. We need to ask a question to refine, to narrow it down, to broaden it up, and so on and so on. This means that prompting is a new skill that we need to learn. Because the better we are capable to prompt, the better the responses, the better the answers will be from the system that we are using. This is an editorial, How to Get Most Out of ChatGPT, Tips and Tricks on Prompting, editorial published in the great journal called European Journal of Cardiovascular Nursing. Let me come to the conclusion. And first of all, this is just an introduction. You will get some worked out examples from Yoon and Megan in the next two presentations, but this was an introduction. And I hope it is clear for you that natural language processing is a branch of AI with a huge potential for nurses and allied professions, both in clinical care and in research. And the reason why this has such a potential is that NLP can make unstructured text insightful. Thank you very much.